At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Adrenal Fatigue, Tired of Being Tired, on Wednesday, October 22nd at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Hey everybody, welcome to Dr. Tom Roselle Live right here on 105.9 FM WMAL in the metropolitan Washington, D.C. area. Hope you're having a great Sunday. We're going to be talking about some things that, you can't figure out why you got up and left. Well, that's what we're going to deal with today. It's like, why am I tired often, all the time, never goes away? What am I doing? And we're going to continue it into the live stream program, and we're going to talk about some of the major reasons. But what I really want you to understand in today's program is how this system really works. Why do people suffer so badly, so often, so continually with this fatigue pattern, this wipeout pattern? And everybody says, well, it's just, that's life. You get older and you get tired and so forth. Not really. There's reasons, that it happens, but it's an adrenal insufficiency. On October the 22nd, coming up pretty quickly now, we're going to be doing an in-house program right here at the Roselle Center for Healing in Fairfax, Virginia. I'd like to invite you. It starts at 6 o'clock. It'll last about an hour and 20 minutes, hour and a half. And we're going to go over what really happens when you're wiped out, you're so tired, you can't keep your eyes open, you're falling asleep all the time, or you're walking around in a fog. It's like you're there, but you're not there. You're present, but you're not present. So persistent fatigue patterns, even after you think you've had a lot of rest and sleep, but that rest and sleep isn't good. We're going to talk about that a little later on. Difficulty even opening your eyes in the morning. You're not even asleep. You just can't open your eyes up, right? Do you ever have that feeling? And stress, handling stress. Are you kidding me? It's like you're hair triggered. You're reactive. You want to punch somebody out, or you react. Nobody can talk to you. That brain fog, that difficulty concentrating, the cravings of caffeine and sugars and salt and fat. Low energy levels constantly throughout the day. You might get a little bit of a blip up on the radar screen and feel fairly okay. The depression, the irritability, the difficulty getting to sleep or staying asleep, and you wake up in the middle of the night, and all these things, have to do with the topic that we're talking about, that we're going to get into on the 22nd in depth. That you go to the doc because you're moody as hell, right? You have, you're constantly in trepidation, anxiety, and then you go down to the pits. It's like you're in the blackest hole ever. There's a reason for that. And often it's because that adrenal system is not firing the way it's supposed to, because you've beat it up over such a long, long period of time. So what are the primary, if you will, the symptoms that are associated? We just listed a bunch of stuff, but we talked about that energy problem, the craving for foods and so forth. Ladies, increased problems with the premenstrual cycle, right? And menopause and perimenopause. Guys, androgen problems, meaning that you go into that lousy parallel place that you say you don't get, that your wives get when they go through menopause. Well, you get it too. It's called andropause. and your hormones are wrecked and shot. This has to do with adrenal fatigue patterns. And on the 22nd, we're going to talk about that. I'm not going to finger point at anybody. I'm not going to call you out, but I'm going to tell you what happens. And maybe, uh, you get up and go, your desire to do anything, your desire for your partner is gone. This is one of the primary reasons because the body is not working the way it's supposed to. Irritable bowel problems and digestive issues of all kinds, the inability to produce digestive enzymes in your stomach has to do with the adrenal system. Headaches that just don't want to go away. You take something for it and it's better, but it's still there. You walk by, an outside road, I don't care how mass you are and so forth, but you're always getting sick, colds and flus and sore throats and all of those things. Now, how about that? We tiptoed a little bit on it, guys. That libido, that ED problem, so forth, the decrease sexual drive. You have like no interest. It's gone. It's completely not there anymore. That has to do with adrenal fatigue. And then, not being able to get that weight off, no matter what you do, that's adrenal fatigue as well. So if you're tired of being tired, and all these things are symptoms of fatigue, tired, it means that your body's not working. It doesn't have the ability to move forward anymore. You can look it up. You're going to see signs and symptoms of adrenal fatigue syndrome. The medical people are going to call it Addison's disease, but that's when the pathology kicks in, and you get there sooner than you want to. But we have to make sure that we're able to diagnose before we get to the place where we let it go too far. The adrenal fatigue pattern is one of the most, I'll say, based on my experience, is probably the primary issue in the degradation, the breakdown of the body, leading to symptoms that just never go away. From your thyroid glands, to your mental state, to your desire to do, your want to get up and go do stuff. So when you see that pattern, what's the contributions to it? Well, we know that stress and even things like PTSD. You saw something that was, you just can't get rid of it. Sitting there, it keeps eating at you and so forth. Smoking, exposure to smoking. People who are vapors, exposures to funguses and bacteria and all kinds of viruses, which are ongoing. If your body's working the way it's supposed to, you fight those things well. There's some genetic pass-throughs, and this is what we're going to call mitochondria patterns. The adrenal system, the brain, the heart, all are dependent on optimization of mitochondria. It has to do with a lot of different enzymes. One's CoQ10. And that sometimes makes a difference for some people. Sometimes it's a problem with something called citric acid cycle. And that means that you can't get rid of your carbon dioxide and making sure you have enough oxygen transporting into tissue. So there's ways of finding that out. One of the things that's really interesting, if I test a muscle, let's just say that, you're complaining of whatever, back pain, hip pain, so forth. So we'll test a muscle. And the muscle that we're going to test is the thigh muscle, the quadricep muscle. And we test it with you either sitting. So we're going to test the hip flexor portion, or we'll have you lay on your back and we'll test it that way with your knee bent at 90 degrees and we'll push on it. And the muscle seems to work. Now, one of the things I'll do is I'll say, okay, what I'm going to tell you to do is just stop breathing. I don't want you to breathe in. I don't want you to breathe out. And while you're doing that, when you stop midstream, I'm going to retest that muscle immediately. And they say, why don't you just do what I tell you to do? And so they breathe in and they're breathing out. They're breathing in, they're breathing out. I said, stop breathing. And then I push on the muscle and 5 seconds, 6 seconds, 7, and the muscle weakens. See, we should be able to hold that for about 12, 13, 14 seconds without the muscle fatiguing when we're not breathing. So what that means is the body's unable to get rid of the buildup of carbon dioxide in the system and making sure it transports enough oxygen residual into the system before it fatigues. So it can be something that is initiated by what's called the citric acid cycle, which has a lot to do with adrenal pathways. And that's another way of checking it. So that tells me that you do something, you walk up a set of stairs and you're tired, just walking up, not out of breath, just tired. And, or you go do something around the house and you need to sit down. Those are all adrenal dysfunctions that have to do with stress patterns accumulated over a period of time. But your hormones, your thyroid, your fight flight system, your cardiac rate, all of those things are totally dependent on that adrenal system working the way it's supposed to. So you should be saying, so why didn't my doctor tell me that? Well, there's a lot of things that people forget to study and apply. There was a good friend of mine. He's a medical physician, and he comes to my training programs on an ongoing basis. Some reason he likes all the stuff that comes out of my mouth. And one day I'm talking about this process, this HPA axis, hypothalamus, pituitary, adrenal. We're going to get into that in the second part of the program today. Now, when we're talking about HPA axis, it has imprint on multiple areas, and everything from how your thyroid is going to work and affects your energetic level and your metabolism and how your hormones are functioning, whether they're too high or too low, chronic pain patterns that never go away because it has a lot to do with the ligaments and the tendons by producing certain steroids that your body should be producing, and so forth and so on. And this doctor friend of mine, he's sitting there and he's kind of smiling, laughing. I said, "What's with you, man? I invite you into my inner sanctum and you're laughing." And I said, "What are you laughing at?" He says, "You." I said, "Why?" And he said, "Do you realize that 90% of the people in my world, that's MDs and DOs, the guys that practice strictly medical applications, have no idea of what you just said and how it applies?" I said, "How can that be?" I said, "I thought this is basic biology, basic biophysiology, basic chemistry 101." And he said, "Yeah, I agree." And he said, "But they all took it. Everybody took it, but they passed the exam that the test was on, and then they forgot about it because all they want to do now is write a drug prescription and get rid of the symptom and not worry about where the initiator was." I don't know about you, my friends, but with the exception of some really good docs out there, it scares me that we're not looking at the triggering mechanisms, the causes, the primary situations, the secondary situations, and how it works. If you look at adrenal insufficiency, and that's really what we're talking about, we want to check cortisol levels at 4 different times of the day. We want to check it in the morning when we first get out of bed. Then we want to look at it at noon. We want to look at it about 3, 4 o'clock in the afternoon. And then we want to look at it nighttime before we go to bed. And it's a real simple test. It's a spit test. You can do it with blood work, but you can do it with saliva. And what you're looking for is the morning cortisol the highest of the day? It should be. And it should be within a certain parameter. Then it should drop a little bit, but not exponentially. If it drops too fast at that 11 o'clock taking or the 12 o'clock taking, it tells you that your insulin level is not kicking in the way it's supposed to transport your blood sugar. So you're going to be tired as hell. Now, what we want to see is we want it to slow down a little bit in the afternoon, but still be enough that we can keep our day going. And then the lowest part of the day is at nighttime, just before we go to bed, so we can go to sleep. We want that cortisol low. So we have to look at that. And then we look at the production of other hormones, DHEA. It's the mother of all hormones because it initiates the production of your strength hormone, testosterone. Guys need it, women need it, we all need it, but they have to be in a certain level. We want to know why other hormones. Ladies, when you go through menopause and you're not menstruating anymore, either artificially because of surgery or just because it's a natural event, your adrenal system, the outer shell, guys, this goes for you too as you get older. The outer shell of the adrenal system is what produces your testosterone. And we all need it. That gives us our integrity. That gives us our ability to, to do what we need to get done, that drive, that want, that movement forward. That and other little pieces of the puzzle gives you that desire to do things. Now, DHEA gives us a clue. We're going to look at progesterone. We're going to look at antibody reactions that are produced in the adrenal system as well. But if your body's fatigued, if it's burned out, it can't do it. And so you wonder why you're getting sick all the time. You wonder why your body's, constantly in a state of crisis, if you will, and not being able to restore function. It's a juggernaut that if we would stop as practitioners to think it through, that we would be able to solve so many problems before they became pathological. Right now, we're talking about a functional consideration. And trust me, it's a whole lot easier to fix something in a functional state. How many of you right now are sitting here and you're wondering, even though that you take certain nutritional supplementations and, I'm taking this B complex and I'm adding potassium, I'm doing some magnesium and so forth, but nothing ever seems to work the way it's supposed to. Why would that be? Well, the piece that we're missing is adrenal problem. Primary adrenal insufficiency is going to have an effect on adrenal cortical stimulating hormone. That tells your adrenal system to push, but if there's no nutrition there, or if it's constantly being pushed, it's going to crash. It's going to reduce the cortisol, so there's no get up and go when you need to have it done. It's, you're going to see low potassium. You're going to see low sodium. Somebody who has adrenal hypofunction craves salt all the time. And it's like they salt things before they even taste it. And you wonder, why are you doing? Taste the food. No, I need to have some salt on it. That's a primary thing. Hyperpigmentation. You see changes in skin tissue because your adrenal system's not working the way it's supposed to. We're looking at blood sugar transport. And if the adrenal system's not working, your blood sugars are going to start creeping up. They're going to get high. That's fight flight. And you go to the doc and the doc says, well, we're going to put you on whatever, right? And the reason that your blood sugars are starting to creep up is because your adrenal shell, your adrenal cortex, isn't producing the insulin levels that it should. Why does that have to do with insulin when the adrenal system is clearly not the organ that produces it? Because it triggers your pancreas to release adequate amounts of insulin. But if pancreas then doesn't have the nutrient or there's an inflammatory level, now you're really in trouble. If you diagnose it correctly, you can begin to reverse it. But you've got to rule out something called primary and secondary problems. And we're going to do that on the 22nd. I'm going to show you what it is and how it is. And I promise you, you're going to say, oh my gosh. Now, you know what's going to take after that? Let me tell you what's going to take. It's going to take your willingness to do what's best for you to get your life back. Did you hear what I said? It's your willingness, your commitment to yourself to get your life back. Because if you're not willing to do it, if you're not willing to step up to the table, it doesn't make any difference what you do. You're going to be in trouble. Adrenal insufficiency, if you will, is so prevalent. My opinion, it's epidemic. It's just as bad as this pandemic we just went through. Actually, it's worse than that, because if your adrenal system was working really, really well during the pandemic, during all that COVID nonsense, you would have fared a whole lot better. So when you see that problem and you see pituitary insufficiencies, when you see radiation exposures, when you see drugs that shouldn't be in the system, don't you think that maybe it has an impact somewhere along the line? The truth of it is, yes, it does. And that fatigue pattern just never goes away. So if you're sick and tired of being tired all the time, join me on the 22nd. Let's talk about it. Let me see what I can do to help you. And we'll give you things. I already gave you a few things to do right now. right? And as we get into the second part of the program, I'm going to give you very specific things that you need to do as it comes to a lot of you wear these wearables, right? I'll call them wearables. You want to know what your heart rate is 24/7. Well, great. So what are you going to do about it? When do you know that you're really in trouble? Take those things off. And if you join me on the live stream, I'm going to tell you why. When the medical approach to treating adrenal insufficiency is using hydrocortisone, and it's divided into doses throughout the day, and they may use prednisone as well. And then there's one that I think is fluticasone. And all of these things they beat that system up. They're replacing the system's ability to do what it's supposed to be doing instead of what? Instead of healing it and respecting your body in a way that it actually will repair itself. Wouldn't that be great? Wouldn't repair be much better than having to drug induce it again and doing something else? But when you look at the body and you look at a crisis, if you will, call it a crisis. That's actually a really good term. And we see the accumulation of joint pain. My joints hurt all the time. Or guess what? You're nauseous. You feel like you're going to throw up all the time. Or you get these moments where you're going to feel like you're going to pass out. Or you get a fever for no reason whatsoever. Or you go into this any kind of pain pattern or blood sugar, going up and down. You go hypoglycemia, which is low blood sugar. You go hyperglycemia, which is high blood sugar. It depends when you catch it, by the way, when you do the blood test. The only one that shows you the average is your A1C hemoglobin, but otherwise your normal serum blood sugar just is what happened yesterday. You're losing your hair. You can't figure out why. Did I say that? Yeah, that's what happens when your adrenal system's not working. You convert too much testosterone into the bad testosterone, which is called DHT, and you start dropping your hair out of the top of your head. Ladies, unfortunately, you too, I'm sorry, but that's the way it works. And your blood pressure is like crazy. Postural hypotension, which we're going to talk more about, is when you get up very quickly from picking up your purse or your shoes or something on the floor and you feel like you've been drinking too much. That's part of the symptom. Guess what? All these things are resolvable if you're willing to restore, resolve, and change your lifestyle. That's it. It's on your hands, but you got to have some guidance. Pain patterns are still there. They're still causing a problem. Hey, did you know that if you have a cough ongoingly, it just never kind of goes away? It shows up periodically. Guess what? That can also be a result of adrenal insufficiency. If when you whistle, it sounds, like you're just wheezing. That would be funny, right? That's a sign of adrenal insufficiency as well. But on the 20 seconds, I'm going to walk you through it. We're going to do a checklist. We're going to say, do you have this? Do you have this? Do you have this? Do you have this? Well, then you better pay attention. And at the end of the day, we're going to show you how to fix it. We're going to give you things you can do at home. We're going to resolve this problem. But there's things that you must be willing to step up to the plate. Otherwise, it's a slippery slope into a gutter that you don't want to go to. I promise you that it's resolvable. Some of you may be so far down the path that it's going to take some time to do. But if you don't stop what you're doing, if you don't change something now, you got a problem that'll never go away. It's unfortunate, but it happens to be the truth. And then you wonder why, towards the end of your years, you start feeling, like, well, life really handed it to you. Your heart's not working. You go into tachycardia. You're not breathing the way you're supposed to. You hurt all the time. You can't drop any weight. Your hormones are gone. You have no interest in doing anything. That's adrenal insufficiency, my friends. And if you want to fix it, we're going to show you how to do that on the 22nd. We're coming up to the place where we're going to go into the live stream. But I want you to think about this. Follow me. I'm going to give you some more data. I'm going to give you a little bit more information on how to resolve this. But register today. Go to drtomroselle.com or rosellecare.com and register for the class. And I promise you, you're going to learn more that night about chronic health problems than you ever thought possible. All right, get ready to join me. Remember, I'm here every Sunday for one reason only at 12 noon on WMAL. I love you all. Let's go.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Adrenal Fatigue, Tired of Being Tired, on Wednesday, October 22nd at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.